Neurology Quiz number 19. What is self-limited epilepsy with centrotemporal spikes, SLECTS? SLECTS is the new name for the condition that was previously called benign childhood epilepsy with centrotemporal spikes or Rolandic epilepsy. This change in name resulted from the fact that in benign childhood epilepsy with centrotemporal spikes, the course is not always benign and cognitive and language deficits and atypical evolutions can occur. Age of onset is between 2 to 13 years with seizures appearing between 5 to 10 years and 80%. It is the most common childhood focal epilepsy and may account for 15 to 25% of epileptic syndromes diagnosed between 5 to 15 years of age. Seizures primarily occur during sleep, usually shortly after sleep onset or just before awakening, and the probability of awake seizures is less than 10%. Seizure frequency is low, with most patients having less than 10 seizures, and 10 to 20% of patients have a single seizure. Consciousness is completely preserved in 60%. The characteristic clinical features are focal motor seizures with unilateral orofacial tonic-clonic contractions, speech arrest, hypersalivation, sensory symptoms with unilateral numbness or paresthesia of tongue, lips, gums, and cheek, and unilateral clonic jerking in an arm or leg with postictal paresis, and generalized seizures. Cognition is in the normal range, but neuropsychological examination may show a range of deficits in language, visuospatial skills, verbal and nonverbal memory, and executive function. The EEG picture is distinctive. Background is preserved in the awake state and sleep. The typical interictal pattern is high voltage diphasic spikes or sharp waves, frequently with slow activity in the central mid-temporal region, with potentiation during drowsy and non-REM sleep states. Role of genetic factors has been presumed because of high incidence of centrotemporal spikes in family members of patients. However, SLECTS does not follow a Mendelian inheritance mode, and clinical and genetic studies indicate complex inheritance. Some genes that have been implicated are mentioned. Treatment may not be required because of the good prognosis and usually infrequent nocturnal seizures. However, AEDs may be indicated if seizures are disruptive to the patient or family, with generalized tonic-clonic seizures or recurrent daytime seizures. Drugs commonly used have included carbamazepine and valproate, but levetiracetam is also effective. Prognosis is usually excellent, with less than 2% of cases having persistent seizures in adult life. Remission usually occurs by 18 years of age. Adults who have recovered from SLECTS do not generally have negative outcomes in the fields of development, education, and social adaptation. However, an increasing frequency of specific cognitive, language, memory, and attention-related disorders are being reported in children with SLECTS. This is an example of centrotemporal spikes in SLECTS. What are the clinical features of primary orthostatic tremor? This is a rare movement disorder characterized by rapid tremor in the legs, which occurs when standing. It causes feelings of vibration, unsteadiness, or imbalance in the legs when standing. The tremor can have such high frequency that it is not visible with the naked eye, but it can be palpated by touching the thighs or calves or by auscultating these muscles with a stethoscope. Patients often complain of having shaky legs. The tremor is position specific and it disappears partly or completely when the patient walks, sits, or lies down. Patients typically avoid situations that require standing still, such as standing in line. EMG shows presence of a 14 to 16 Hz tremor in the legs, especially the calf muscles, when standing. In some patients, leaning on the arms may provoke a similar frequency tremor in the upper extremities. The exact cause is unknown, and some experts believe it is a variant of essential tremor. There may be a positive family history. It is a chronic condition and can affect quality of life. Treatment is challenging and not always effective. Clonazepam is commonly used. Other medications have included gabapentin, levodopa combined with carbidopa. Other drugs used include primidone, propranolol, pramipexole. Deep brain stimulation may provide benefit if medications fail.